Hello everyone, welcome to 100 Most Important Physiotherapy MCQ Part 2 for MPT entrance exam in government physiotherapy jobs. Let's come to the question number 1. The most common cited disc prolapse is option E L2 L3, option B L3 L4, option C L4 L5 and option D L5 S1. The answer is L4 L5. The common site in lumbar region disc prolapse are L4 to S1 and the most common in L4 L5. See here the L4 L5 disc bulge. Question number 2. Coxa vara is found in option A Perthes disease, option B tuberculosis, option C rickets and option D rheumatoid arthritis. The answer is Perthes disease. Perthes disease is a rare childhood disorder that affects the hip joint. What is the coxa vara? Coxa vara is decrease in femoral neck soft angle below the normal range. So what is the normal range of femoral neck soft angle? Is 140 degree. The coxa vara decrease the femoral neck soft angle below 125 degree or below 120 degree. Question number 3. The least common cause of brachial neuralgia is option A cervical spondylosis, option B Paincoat tumors, option C cervical ribs and option D Tight syndrome. Answer is Tight syndrome. Degenerated changes of cervical spine. Paincoat tumors are superior sulcus tumor is a lung tumor that affect the apical chest wall. Cervical rib is an extra rib that forms above the first rib. Cervical ribs having on right side, left side or both sides. Tight syndrome are usually affect 3rd, 4th, 5th costochondral joints and the pathology of tight syndrome is respiratory tract infection. The causative agent are virus and symptom chest wall pain. Question number 4. In cervical spondylosis, which part of vertebral badly involved? Option A inferior articular facet, option B pars interarticularis, option C superior articular facet and option D all of the above. The answer is inferior articular facet. In facetal arthropathy, superior articular facet and inferior articular facet are involved, but badly involved is inferior articular facet. Question number 5. The most common deformity in club foot is option A equinus, option B equinovalgus, option C equinovarus and option D calcaneovalgus. The answer is equinovarus. The club foot is also known as CTEV, congenital talipes equinovarus or talipes equinovarus. The deformity of club foot is combination of equinus and varus. Equinovarus deformity. The foot is plantar fax and inverted. And this is the supinated foot. See the picture and guess the condition. And comment below. Question number 6. Dogersum is a kyphosis condition that found most often in option A children, option B sedentary males, option C young males and option D postmenopausal osteoporosis. The answer is postmenopausal osteoporosis. Question number 7. The IR lamp is positioned at the distance of option A 10 cm, option B 100 cm, option C 45 to 50 cm, and option D none of the above. The answer is none of the above. To achieve maximum penetration, the lamp is placed at the right angle to area to be treated. The distance from the lamp can be about 60 to 75 cm for large lamp and 45 to 50 cm for small lamp. In these questions, the lamp size cannot be mentioned. The answer is none of the above. Question number 8. Bimalar fracture is called option A Pott's fracture, option B Masoniois fracture, option C Chopard fracture, and option D Jens fracture. The answer is Pott's fracture. Pott's fracture is bimalar fracture of ankle joint, fracture of medial and lateral malleus. Question number 9. Main risk of fractured scaphoid is option A non-union, option B malunion, option C delayed union, and option D avascular necrosis. The answer is avascular necrosis. Question number 10. Cervical spondylosis is more common at option A C1 C2, option B C2 C3, option C C6 C7, and option D C4 C5. The answer is C6 C7. Are usually cervical spondylosis occur at the C5 to C7 vertebrae. See the picture and guess the knee joint deformity and comment below. Question number 11. All are the causes of genu varum except option A Bland's disease, option B rickets, option C malunited fracture, and option D recurrent dislocation of patella. The answer is recurrent dislocation of patella. Genu varum is also called bony, and genu valgum is also called knock knee. See the picture and guess the conditions and comment below. Question number 12. Congenital muscular torticollis is caused by the fibromatosis in filling the blanks muscle. The option is option A trapezius, option B splenius capitis, option C sternocleidomastoid, and option D pectoralis major. The answer is sternocleidomastoid SCM muscle. Question number 13. One of the function of basal ganglion is option A increase the muscle tone, option B produce small jerky movements, option C inhibit stretch reflex, and option D control auditory function. The answer is increase the muscle tone. Function of basal ganglion: entry movements, postural control, in control of the muscle tone. Question number 14. Myositis ossification is commonly seen at option A elbow, option B hip, option C knee, and option D shoulder. The answer is elbow. See the myositis ossification of post supracondylar fracture. Question number 15. All of the following are useful in diagnosis of congenital dislocation of hip except option A. Ottoloni test, option B. Barlow's test, option C. Slocum test, and option D. Galeazzi-Ellis test. The answer is Slocum test. Ottoloni tests are relocation tests and Barlow's tests are dislocation tests. Galeazzi-Ellis tests are used to assess the limb length discrepancy, and the Slocum test is used to testing of anterior instability of knee joint. The Ellis test used for the LLD assessment of congenital dislocation of hip joint. Question number 16. Pseudoarthrosis can be due to all except option A. Congenital, option B. Post-inflammatory, option C. Traumatic, and option D. None of these. The answer is post-inflammatory. In the pseudoarthrosis can be due to the congenital and traumatic. Question number 17. The McMurray's test is used to evaluation of option A. Meniscal injury, option B. Fracture of hip, option C. A joint following replacement arthroplasty, and option D. In orthopedic implants. The answer is meniscal injury. Question number 18. Cogen test is a clinical test for diagnosis of option A. decurvent stenosynovitis, option B. lateral epicondylitis, option C. carpal tunnel syndrome, and option D. myasthenia gravis. The answer is lateral epicondylitis. Lateral epicondylitis is also known as tennis elbow. Question number 19. The depth of penetration of MWD is option A 0.5 cm, option B 3 cm, option C 1.3 cm, and option D 9 cm. The answer is 3 cm. The full form of MWD is microwave diathermy. Question number 20. Normal Q angle is option A 5 degree to 10 degree, option B 10 degree to 15 degree, option C 15 degree to 20 degree, and option D 26 degree to 32 degree. The answer is 10 degree to 15 degree. The normal Q angle 10 degree to 15 degree, and the increase in Q angle, the deformity of knee is knock knee, and decrease the Q angle less than 10 degree, the deformity is knee is bow-legged, bow knee. Question number 21. Oblique X-ray view is required to diagnose fracture of option A capitate, option B scaphoid, option C navicular, and option D hamate. The answer is scaphoid. Question number 22. A typical base of support in walking is about option A 2 to 4 inch, option B 1 to 2 inch, option C 3 to 6 inches, and option D none of these. The answer is 2 to 4 inches. The decrease in base of support during running. Question number 23. The rotator cuff is composed of 4 of following muscle except option A teres minor, option B supraspinatus, option C infraspinatus, and option D teres major. The answer is teres major. The rotator cuff muscle is supraspinatus, infraspinatus, subscapularis, and teres minor. Question number 24. Which of the following is regarded as the definite sign of fracture? Option A tenderness, option B local body irregularity, option C crepitus, option D swelling. The definite sign of fracture is crepitus. Question number 25. TENS is a low frequency type of current, microcurrent, in C high frequency type of current, in D medium frequency type of current. The answer is low frequency type of current. To see this chart, the different frequencies of the very low frequency, the low frequency range is considered 3 kHz to 300 kHz. Medium frequency 300 kHz to 3 MHz. And the high frequency is generally considered 3 MHz to 300 MHz. थैंक यू सो मच. मिलते हैं नेक्स्ट वीडियो में. 100 most important physiotherapy MCQ part 3 is coming soon. Please comment below and like, subscribe and share.